Hi, good afternoon to everyone. My name is Kim Hui. I am the head of the School of Nursing, Faculty of Medicine, Bioscience and Nursing for MAHSA University. This afternoon, I'm very privileged to share with you a very interesting topic that is Nurse Navigator, Industrial Revolution 4.0 and how it impacts the patient's care of our generation. Now, in short, Nurse Navigator most is identified as a senior advanced nurse practitioner in the healthcare system. It provides vital services to a complex health condition of the patient. It can be a patient suffered from an acute heart attack or even a patient with an advanced cancer. Now, for patients like that, we require a complex, comprehensive clinical care, multidisciplinary, from the physicians to the nurse to the laboratory technologies through the imaging diagnostic department to render care to the patient. And the nurse navigator, or are more commonly being recognized as advanced nurse practitioner, are required to perform complex assessment, triaging the patients using the advanced clinical nurse decision making. And the most important thing is to help to facilitate the journey of the patients from the moment from primary care to tertiary hospital until the patients get their treatment and discharge home. Industrial Revolution 4.0 in healthcare in particular are defined or focuses on digital technology, and it is an access to real-time data. When we talk about real-time data in healthcare, will be basically the assessment finding of the patient's vital data, as simple as their temperature, blood pressure, to as complex as their laboratory result, their X-ray reading result, as well as also their pharmacological treatment and diagnostic treatment finding. Now, with that in mind, Malaysia has this mission of developing Malaysia as a high-tech nation of 2030. Now, when we come to that 2030 to now 2022 is 8 years from today. So how it impacts nursing care in particular in this new era, nationally and internationally? Every one of us has gone through pandemic situations, and the 2 years, with that, the concept of patient care has evolved from coming into the primary care setting or in the hospital, line up to get a registration number, line up waiting to see a doctor, and then to wait for your time to have your blood test done or your diagnostic procedure being carried out, into a situation where there's drive-through vaccination, where appointment, the time, payment are all done online. And therefore, many hospitals has gone into this technology whereby patients has full control of themselves from at home online booking of the consultation, whether it's a new patient or a follow-up. And so you are able to know and slot the appointment time for yourself rather than you call the hospital. Second is that you can use the QR code to even scan and register yourself, and you can go for your other activity while waiting for your time, and you know that your blood test is now being processed, and when it is done and being accessed by the physicians. So this is the whole lot of the IR 4.0 into healthcare. Lastly, will be all this data, physicians can access it real time at home or in the hospital. And therefore, that actually has made healthcare more accessible, as well as also the care and the treatment that can be given to the patients in a timely manner as compared to before that we have to wait for the consultant to drive all the way from home or from other facilities to the center and then flip on the notes, look at the laboratory result and so on and so forth. Now the third opportunity of IR 4.0 in healthcare is that we can seek second opinion from a different country. For example, in some hospitals already have that called clinical management, whereby each week there is a whole team of oncology team from the oncology surgeon, oncologist, the radiographer, the nurse, as well as the palliative team will then actually have a clinical case conference with another country, and then they talk about the management and the treatment of the particular patient from admission until discharge home. And therefore that makes healthcare more accessible and affordable rather than you have to travel into a different country. There is, with this advancement in the patient's care, then we comes into what will be the role of the nurse? How do we equip ourselves into the nurse navigator in the IR 4.0 industrial in the perspective of healthcare? Now, in Malaysia, we have registered nurse with the exit level of diploma in nursing. And so, and the second exit to get it registered will be a degree in nursing. So how do we equip these nurses to this advanced role that is actually through our education that is provided, also through the clinical experience at the tertiary hospital that has started to utilize our IR 4.0 healthcare industry technology into their care. And that is how Malaysian Nursing Education prepare a pre-registration nurse. Now then the second level will be, how about those that has already had good experiences in healthcare? What do they do? How can they equip themselves? Well, there's an avenue for that. We have the, we call it post-registration or ODL, Open Distance Learning Mode. In this education system, it is for national and international takers. And so with that extensive intellectual exchange of the experiences, both nationally and internationally, the learner will be able to expose to various types of nurse navigator role in using the IR 4.0. And that has equipped our nurses for national as well as international role. Now, we also can equip our nurses into specialized clinical care. And so here in Malaysia, we have post-basic certificates in renal critical care, peri-op, and midwifery, pediatrics. These are a few common specialization that we prepared our nurses. And with that preparation also, industrial 4.0 as well as also advanced nurse practitioner role has been incorporated into the preparation of our nurses to the new era. Lastly will be the Postgrad Program that has been designed for the nurses to face and to be equipped with this new generation of patients' care in the healthcare system, with advanced clinical nurse decision making, with the advanced management and leadership skills, and with the international exposure with various learners from all over the world. Now we have, so over in MAHSA, we have prepared our nurses in this arena, and I would like to share one of the very significant alumni story about how MAHSA, Master in Nursing, has prepared her to go into globalizations to be a good nurse navigator as in this IR 4.0 in healthcare. During the 2 years pandemic, our graduates, the recent graduates, has undergone our education's Master in Nursing with MAHSA. She has worked in the only one hospital in Pakistan for 18 years. Having fear to step out of her own comfort zone, having fear to step out from her own country. However, with the educational preparation as well as intellectual exchange in the whole entire classmates that composed of not only Malaysia private nurses, government nurses, nurses from Saudi Arabia, nurses from Singapore, from China, Pakistan and Egypt and India, that has given her a whole lot of confidence and determination. Now, upon the completion of her studies, she has successfully, through the encouragement as well as also networking, an opportunity to work abroad at United Kingdom, and currently she works as the advanced nurse practitioner at the Cambridge University Hospital Foundation Trust in UK as an oncology nurse. And she's happy and she felt very confident with the education provided. And with that, I would like to encourage all of you to further consider taking advanced education to prepare yourself for this advanced practice role into this advanced technology in healthcare. For those of you who are interested, please visit our website at MAHSA, and you can call the School of Nursing for further inquiry. And that's my sharing of today, and I wish all of you the very success in your journey of caring for patients as well as finding job satisfaction through advanced education that you have in MAHSA. Thank you and good.